Hello, everyone, and welcome back to Level Up Your Mental. My name is Ariel, and I'm a licensed mental health counselor in the state of Florida. As many of you know, May is Mental Health Awareness Month, and I thought that it would be important for me to speak about integrated behavioral health care as being a doctoral student of behavioral health, and just the importance of why, this is important, the aspects of it, and how I can contribute to that when I complete this program. So first, what is integrated behavioral health care? Integrated behavioral health care is basically a collaboration between primary care doctors and mental health providers that come together to give whole person care to their patients, right? So a lot of us know that when we go to primary care physician offices, we see the doctor, they tell us what's going on. A lot of times they will refer us somewhere, and then we have to go ahead and follow up with that appointment. With the whole part of integrated behavioral health care, you would see your provider, and then if they feel like there are some things that highlight the behavioral aspect, then they would do something kind of like a warm handoff in a lot of circumstances where you would be, myself as a behavioral health provider would be in that building, and they can kind of just transfer you to another room, or I can pop into the same room and have just conversations about how maybe that physical health part is contributing to your mental health, and how we can play a part, and how I can work with your provider to be able to give you that whole person care, right? And so this picture that I have up that I got from a website called the Cribsiders. It's for pediatric medicine, and I want to give credit to Jessica Reed, who's an MD. And she basically just put this thing together, and it basically just gives an encapsule of why integrated care is very important, how we can work to bridge the gap, and what that means, right? So the barriers to care as of right now as a behavioral health provider is that there's limited providers, so we're not having as much providers being able to give, mental health care to the people that need it. There's long wait times, kids going to school and not missing school to be able to see their providers, transportation, and definitely insurance gaps, and just being able to cover that, right? With the work being towards coming together and giving that whole person care, the outcome is to improve access. So with us being in the building, we would be able to just be there to be able to give the information and making sure that people follow up. A lot of times, you'll give people referrals, but it's hard for them to get appointments. It's hard for them to even just find a provider, and so that kind of falls off. It definitely reduces the stigma. It reduces symptom reduction, so people don't have as much symptoms, because we're not only working on the physical aspect with the provider, but then we're also looking at the mental health part, and how those two things work together, and how it's important to work with both. And then having support of your primary care doctor and parents together, and then of course having less ER and hospital visits. And so for myself, as I complete this program, I want to be able to have my own building where I can have the collaboration of both, and to be able to provide that whole person care. But as for myself, the skills that I want to build is to be able to integrate faith and as well as behavioral health together. There are a lot of people that come from my background, people of color, people who have Caribbean background, where spirituality plays a big part, and we don't ever want to diminish that. So I think working together to understand that spirituality part and bringing it together with the behavioral health will definitely learn to bridge a gap. And then for myself to just allow these communities to trust me and understand that we're not competing with the spiritual part. If anything, we're just adding on to it, and we're just making sure that people are accepting of integrated care, and understanding that you don't have to neglect that part of your life. You just come together and bring those things together. Another thing would be addressing a lot of social detriments in immigrant populations. Again, coming from somebody that has a Caribbean background, a lot of my family was born in Haiti, outside of the United States. They were immigrants, and now with them being here, I want people to understand that I understand that part. I understand what it means to have that stress, to have that financial strain, having barriers to access to the things depending on where they are, how much money they have, and what they have access to, and a lot of discrimination. And so being able to bridge that gap and help people understand that just because you come from this doesn't mean that you can't get this, I think would be an important skill for me to be able to incorporate once I complete this program. And then the other thing would be community outreach and advocacy. And that is something that I stand by even now with having this page and having a voice out there, is to be able not only to speak up for the people that look like me, the people who have the same background as me, but then also to just stand up as a woman and just being in this field and just helping people understand the gap between being a woman, being a person of color, being a person who has a Caribbean background, and having those communities just come together and just organize, and making sure that I advocate for why this is important, helping people understand that there is a diverse group of providers that would be able to help and to be able to give people the support that they need. And, you know, I can be part of those trusted people that are going to make a change in the community. So I think being able to have all those skills, you know, will allow me to not only create an impact when it comes to integrated behavioral health, but tend to go beyond the traditional clinical settings and go into the Caribbean community, and, you know, where stigma and barriers and everything often prevent people from getting help, and to let them know that, you know, it's okay when you see your primary care provider. I will also be there to help you understand that not only are you going through this and you might possibly be taking medication for something, but how is this specific thing affecting you in other realms that you might not even notice, or stuff that could happen, and we're trying to prevent that. So I think it is important to just highlight what integrated care means, like this picture is presenting, making sure that people are understanding why we're there and how the importance of whole person care is very important. And just for myself to create a place and create a structure that is inclusive and supportive of healthcare, and to just reflect on my commitment and my compassion to accessibility and making meaningful change in the world, and to let people know that look like me that, you know, you can get the help that you need. And a lot of these things are, you know, it's okay. They're to push back on that stigma, and to just let people know that it's okay to get the help, and to let providers know that we can work alongside them to be able to help people in their times of need when it comes to physical and for their mental health. So I'm going to post more information on integrated care in the caption below. If you guys have any questions, you can just let me know, and you can join in on the conversation in the comments. And I will see you guys in the next video. I appreciate you guys for watching this one. Bye.